Hello doctors, good evening. Welcome to this new episode in this channel, and today we are going to discuss about the roles and responsibilities of the doctors, mainly the specialist and consultant in the hospital and clinic setup. Okay. So as usual, what is the documents to refer before applying the doctor's job in UAE? It is the PQR document, which is called the Unified Healthcare Professional Qualification Requirement. So whatever the details which I discuss, usually I refer these documents and I'm usually explaining. So what does it contain? It contains all the educational qualification, experience, exams equivalency criteria for all physician, surgeon, dentist, nurses, midwife, complementary medicine and allied healthcare professional. So the main topic is who can apply for the specialist doctors. So the main categories will be the MD, DNB, MS doctors and the MCH and DM doctors can apply for the specialist job in the hospitals and clinics. What is the minimum requirement experience required for the specialist to apply here? So now we come into the two categories. One will be the master's degree, second will be the super specialty degrees. All the master's degrees will require 3 years of experience. Completing the post PG clinical experience will be required to apply for the specialist, and for the super specialty they can apply directly for the post of for the specialist in UAE, especially in Dubai. Now come to the what is the roles and responsibilities for the specialist in hospital sector. So here comes the major topic where there will be two categories. One will be the MRP post and second will be the hospitalist or also called the specialist registrar post. Both of them require specialist license, but the jobs and responsibilities are different. So come first we will discuss about the MRP, which is the most responsible person, which is equivalent to a consultant work in India or any major cities. So it's or you can equivalent to the assistant professor in any medical college, private medical college or the government medical college. So what is the main thing? He is the main responsible person, so he has a more individual responsibilities where he need to take a decision making because he need to admit the patient under him. He will be given a separate OPD, he can admit the patient under him, he will have a IP rounds and he will have admission day for admitting the patients, where he can admit from the OPD or on the admission day whatever the patient admits on the day, it will be admitted under him. So what is the minimum requirement? You need at least 5 years of experience to apply for this post. Minimum, maximum it will be like 10-15, but minimum 5 years of experience to apply for the specialist MRP post. So for all people, majority of the GP specialist consultant, 48 hours shift is the 48 hours per week is the maximum requirement. Minimum maybe you can work for 40 hours or 45 hours, but maximally 48 hours per week. It will have 8 hours per day for 6 days, or you can take 1 day off. This is the usual setup for this MRP post, and there won't be any night duty, but you will have on call duty. As I said, it is like an admission day duties, and salary anywhere between the 35,000 to 50,000, but still here it depends on various factors, including the type of the hospital, Western degree, the college which you studied, the fellowship degrees, and all this even the nationalities come into play for the salary. And who can apply? MD, MS, DNB, MCH, DM, all can apply for this MRP post. Second is the specialist registrar or hospitalist post. This is more like a duty doctor with more salary, who has a degree equivalent to the master's degree. Mostly the MD, MS, MCH or DNB candidates, and the super specialty candidate doesn't come into this category. So it is more of like a PG work in the medical college or hospital, or a duty doctor. They will have a rest responsibility because they don't admit the patient under him, and they will be discussing with the immediate higher MRP specialist to take any major decisions. So no admission rights. Requirement, minimum 3 years requirement is enough to work as the specialist registrar post your post graduations, and same 40 hours per week, But the thing is, here there will be a night duties where you have to work for 2 days day shift, 2 days night shift. So most probably you will have a 12-hour shift per day. So 2 day duties and 2 night duties. There won't be any on-call duty, which means less responsibility. 12-hour shift, finish your work, go home, take rest. Nobody is going to call you unless if there is any extra help. Salaries, it will be little less compared to the MRP, anywhere between the 30 to 40,000 AED per month, and the requirement, it will be MD on DNB and MS degree can apply for the specialist registrar post. Okay. So what is the roles and responsibilities of the specialist in clinic setup? So this is quite easy. It's like you require only minimum 3 years of experience. It is like a proper OPD practice how you work in any country, and it will not have any night duties, same 48-hour shift per week, and there won't be any nights. As I told you, it will have a straight shift, split shift. What is straight shift? It will have a 9 to 5, 9 a.m. to 5 p.m. or 1 p.m. to 9 p.m. or you have a split shift, which is like 9 a.m. to 1 p.m. and you go home, take rest and come back at 5 p.m. to 9 p.m. So it is a usual practice. Mostly it will have a polyclinic. Individual clinics are quite rare and it is difficult to sustain. They will have a polyclinic. You will not have an admission rights. If you want to admit the patients, you can easily refer the patients to the nearby hospital to admit the patient under them, and once they discharge, they will come back to you. So you can take admission at this hospital, but it is your headache. Like you have to work for 8 hours. Again, you need to go and take the rounds in the hospital. It's not necessary. So you sit in the clinic, refer the patient for admission. Salary will be around 20 to 35k, but this salary range, it's very, because the established clinic will give a little more salary. Even now the people are coming for even for 10 to 15k per month AED. There are people who is ready to work as a specialist in clinic. So clinic status is quite pathetic situations. Now who comes here? He is who can apply for the consultant. Any DM or super specialty MCH with more than 5 years of experience can apply for the consultant job in UAE, or the Arab board with 5 years of experience, or the physician with the following degree: ABMS, RC, PSc, CFPC, CCT. All these people can apply for the consultant job. Any further thing, kindly refer the PQR for the further consultant requirement. So what are the roles and responsible consultant in the UAE? They are the still MRP, no night duties they will have. They will have the shift duties, 40 hours per week, and it is more of like equivalent to the HOD. And some consultants, some hospital have a many consultants, some hospital, majority hospital will have only one consultant, because it's like an HOD in the department. So majority will work in a hospital, only few works in a clinic. Salary is way more higher than the specialist. I cannot disclose the salary for the specialist, for the consultant. So extra bonus point: how many days of leave in a year you can apply comes. The main thing is, the main catch is you have a 30 days of paid annual leave in a year you can take, and if you don't take annual leave, you can just postpone few days of annual leave to the next year, or some hospital encash your leave, but it is absolutely not necessary. If you have a leave, kindly take the leave and take rest. Other leaves will be the government holidays, which is the public holidays. Almost 12 public holidays you will get. So if you work on the government holidays, you will be given a compensatory leave, so you can avail on the later part of your days. So sick leave as per your contract, and study leave as per your contract. Some hospitals give 5 days of study leave, some may give 7 days of study leave, some hospital don't give any study leave. Roughly 5 to 7 days of CME leave, where you can go for a conference, international conference, local conference, you can take this CME leave. So can take these 30 days of annual leave in a single stretch, or you can take in a different part, like 10 days, 10 days, 10 days in a year. I prefer to take in a split. So at the last, I thank everyone to listen this topic patiently. till the end, and kindly subscribe the channel, and I will come again with a few videos with more updates for the doctors who wants to work in UAE. Thank you.